do a bio, I'm gonna keep it moving.
No, you don't need to do a bio. Oh God, I can do this. Yeah. Okay. This is on. Okay, so she's not going to do a bio, but my name is Adrienne Lara. I'm homebred from here. I grew up in Oxnard, and Bernard. Okay, so I grew up in Oxnard, and I went to Santa Clara High School. When my counselor told me I was Mexican and I probably wanted to get married and have kids, so don't be a doctor, I went into nursing. So I was a nurse for 10 years, but I started med school at 30 and did it. And so I left Oxnard, yeah. These are my credentials. I left Oxnard, I went to Boston University School of Medicine, got accepted to Harvard, got trained at Harvard, and then stayed there 11 years teaching, and then came back. And now I'm doing pap smears on my high school classmates. But that's kind of private. Okay, so Denise was talking to me and said, what do you want to talk about? I said, oh my God, women need to know more about sex and what the options are and what the problems are and how to treat them. And then she told me I only have 15 minutes, and then I said it's going to have to be a quickie, okay? But as we know with quickie, if you've ever had a quickie, don't raise your hands. We know that that's not enough time, and we don't go really deep. So that's what we're going to do. We're not going to use a lot of time. Okay. So I want to talk about sex where the women come in to see me as a gynecologist to talk about it. That's between the ages of 40 to onward, 55, 60, because it's the perimenopause and the menopause time, and our sexual life is affected by estrogen, immediately by estrogen. So let's define. Premenopause are all those childbearing age women. So I'm not going to help you because only about 16% of you have painful sex, and it's usually an infection. Okay, so you guys are over there. But we're going to talk about who is premenopausal. Now, if you look at the clinical studies, premenopause starts about 7 years before actual menopause. Average age of menopause is 51, so premenopause starts at 44. Clinically, your estrogen starts to depress or go down at 30, but at 40 it takes another leap down. And I love estrogen. To me, it's the best hormone in the whole body. It's like Glinda, the good witch of the West. She just goes around and sprinkles her estrogen, and I am the good hormone. And anyway, finally, the minute the FDA figured it out, they took the black box off of estrogen. We should have had that black box off 25 years ago because, yeah, the studies have now shown, and I'll explain, they took it off. Studies have now shown that the original studies that said breast cancer, heart attack, stroke, all were flawed studies. They've had follow-up studies to recognize that estrogen, this is the biggie, so the drum roll. Estrogen, and 4 years ago, there was a study out that said if you take your estrogen closer to menopause, 50s, 55, you will have heart protection in your 60s. Which is the number one killer of women, right? 1 in 6. I am now, the standard of care is to offer every woman at menopause in her early 50s hormone therapy. So, because there's two things that it can help that nothing else can. One is heart disease, and the other thing is osteoporosis. Okay, so you have to remember that. This isn't sex. Okay, so 40-year-olds up until they have menopause. The definition of menopause is no menses for 12 months in a row. If you start to bleed at 6 months, we start the count over. Okay, which many women are disappointed. But that's what the definition is. And that is a time when you actually have a decrease in your estrogen. And the estrogen feeds so many parts of your body. We already know it's in the brain, it's in the heart. I had some statistics that I thought were really interesting, if I can bring them up. It had to do with how many women, one of the things that had to do with sex was how many women have painful sex. I actually know them. Premenopause in your 40s, about 30% of women will report painful sex. When you have menopause, up to 50%. That means 1 out of 2 women, count your table, 1 of them has painful sex if they're that age. Okay, so we're going to talk about painful sex, dry vagina. We're going to talk about orgasm or lack thereof. That's called. I don't think I could teach you all how to do that. Okay, I looked at all the people having people stand up. I go, I don't think I could teach them. Not there, not in a public place. There are things I can do with medicine that will help you. 100% they've helped. The last thing we're going to talk about is low libido. So these are my patients, premenopausal, menopause. Dr. Lara, I don't want sex anymore. I go, okay, what do you think when your husband wants to have you there? I just tell him, cover me when you're done, you know. Or I've heard women say, I go, so what do you feel when you see Rick? You look at him, she goes, styrofoam, you know. So these are the kind of things that I hear. And we do have, libido goes down because estrogen and progesterone are like Jack and Jill. They go down together, they need replacement. A little later on, testosterone goes down. So we're treating menopause symptoms, and then later on, the low libido comes in. And that's what happens. And it's all physiologic. I talked to God, and I think that God thought we were all gonna die about 59 to 60, and he forgot to keep our ovaries growing, but that's supposed to be good because then we can't get pregnant at 70. Although I've thought about it. Okay, but anyway, so let's talk about those things. So in the statistics, the other thing that happens is anxiety and depression when you have painful sex. The same statistics, premenopausal, your 40s, about 20% of women have a direct correlation between painful sex and depression and anxiety. And I don't need to explain that to you. When you're in your 60s, the same thing occurs, but to a higher degree. So what do we do with painful sex? We, like every doctor, we have to find the etiology or the cause. In menopause, when you decrease your estrogen, the whole vaginal wall and the doors on the outside are all covered with estrogen receptors. When you dry up from that estrogen, God gives the estrogen to the brain, a little to the breast, and he goes, oh, this isn't that important. But we know it is. And so now we have estrogen supplements that you can use. So what do I do with my patients? When you have painful sex, I discover what it is. We generally use estrogen supplements. Nobody likes the cream because it's gooey, it's big white cream, and it looks like you have a yeast infection. But anyway, so they don't like to use that. There is Imvexy, which is a tablet, which I personally have used, and within 2 weeks, there was a different vagina. Oversharing. Okay, and the other thing that you can do are you can use capsules. Capsules work too, that actually are a precursor to the hormones. By the way, I'm not asking, but I heard there are women in this room who have a history of breast cancer. There are enough clinical studies out to say that if you have a dry vagina and you've been using anti-estrogen treatment for breast cancer, you can safely use estrogen in the vagina. It does not travel up to a large enough degree systemically, so you shouldn't have to preclude sex. And I had a 34-year-old woman who we diagnosed with breast cancer who called me and said, you need to save my marriage. And that was the story. So I definitely looked up all the studies, sent them to her oncologist, and she had 2 kids after that. So I guess things are okay. So another patient. A lot of this happens to women who have had vaginal deliveries. We get an episiotomy, which means there's a cut between the vagina and the anus to make more room for the baby's head to come out. It gets stitched up and we go away happy with the baby. What happens is you're forming a scar there. So the scar there doesn't have the same integrity that you used to have. It doesn't have the same blood vessels, the same nerve endings, and it's often hard like a scar is. I had a patient once that told me, every time my husband goes in, he rips a little bit of that. I scream, and I think he thinks I'm enjoying it. I go, well, you know what? I could kind of see that. And so what we did with her was we redid her episiotomy. We took out the scar tissue and redid it. Another thing we had tried in another patient like that was PRP, so platelet-rich plasma to regenerate that area. All right, is it orgasm or libido you want to go to? I knew it. You guys you're my nasty girls. Okay. Me too. I love orgasms. I just love them. I always say this about orgasms. Orgasms are the most selfish time you'll ever have. Because you cannot orgasm when you're thinking about your partner or anything else. That's when masturbating is so good, because you're just focused on yourself. It's stronger, it's better, and you don't have to say anything to anyone else. And there's no wet spot in the bed. So those are good reasons. So let's go to orgasm. A lot of patients cannot have orgasm. I certainly have had patients who have never had an orgasm and they're in their 50s and 60s. So yeah, I have taught masturbation to patients. I've shown them where they never knew where their clitoris is. Oh, sidebar. Did you know that the clitoris, I love this one. Did you know that the clitoris is the only human organ made for pleasure? Let's hear it for the clitoris. Yeah, we got it. The other thing is that it never ages. They did a biopsy of an 18-year-old and compared the tissue to an 80-year-old. The tissue looked exactly the same. My clitoris and yours does not age, okay? So that's good. So orgasm. Why do women not have orgasms? There's a whole slew of ideas or reasons why they don't. Sometimes it's their cultural, religious upbringing. Sometimes they've been abused. Sometimes they are not comfortable releasing, letting go. But we always check the function and check and make sure that the clitoris is healthy first, and then we proceed. So what do we do with those patients? We actually do tell them to learn what makes you happy. In other words, masturbate and find out what do you like about it? What makes you feel good? You have to know that. I had a 28-year-old who came into my office, and she had her legs up in the stirrups, and I was doing her pat. She goes, "You know what, Dr. Lara?" I go, "No, what? My boyfriend doesn't give me orgasm." I went like this, slapped, and looked at her face and said, "Not his job." Okay, it really is not the man's job to know how, when, or where to give you an orgasm. He has no data for that except what he's done before, and you have a responsibility, if you want that pleasure, to know what pleasures you and to teach him or to tell him or to ask him. But the thing I've used most successfully, which works 100% of the time because the cause of the orgasm or lack thereof is nerve stimulation and blood flow. We do PRP injections straight into the clitoris. I'm going to let you all feel your icky ickies on that. No, it doesn't hurt at all. We have a 20% lidocaine that we spray, and we have the patient put on numbing at home. She comes in and she doesn't feel a thing. Where do we inject? And then I'll explain PRP. We inject directly into the clitoris. It has a wall in between, so you have two sides of the clitoris, the clitoral hood. And if you go look tonight, the clitoris has two little pieces of tissue coming out at the bottom like arms, and they're the very beginning of the small lips, that very beginning. So the hood, the clitoris, and the beginning of your labia minora all have a direct connection through the posterior nerve and the pudendal nerve that goes straight up to your sexual excitement center in your brain. So if you want to teach someone how to do it, you just teach them. There are 3 areas, and I'd like circular. Most women like circular. Find out if you're a lefty or a righty. Okay, because we definitely are, and some are an all-aroundy, okay? Yeah, so we inject into the clitoris, we inject into the clitoral hood, that little beginning of the small labia minora. We go underneath and feel the G-spot right behind the pubic bone, that little bundle of nerves that is still part of the clitoris. We inject there. Women with episiotomy or not, where do we hurt? We hurt where the 180-pound man puts the penis at the bottom of the vagina, right here, whether you've had an episiotomy or not. So we put PRP there. PRP is platelet-rich plasma. It means that there are 3 blood cells in your blood called the white blood cells, the red blood cells, and the platelets. We get rid of the red and white. We only have the platelets. It's like liquid gold. And what do? Say you're in the kitchen and you cut your finger, you're chopping tomatoes. Right away, the platelets come down, they stop all the bleeding, and then they explode into growth factors, angiogenesis, neurogenesis. They can build anything that spot on your finger says, I need to correct, I need to heal. So it's like kind of like this. What if we put that into your clitoris? It's not really broken, but it could use some help. It's going to take your clitoris and it's going to increase blood flow. And blood is like the element, I was thinking Spanish, alimentación. Blood is like the food to the nerve endings. So you're going to get a higher sensation, you're going to get better blood flow, it's going to be a shorter time to orgasm. Your orgasms are going to be amazing. Femshot. So you can rejuvenate your clitoris, which is responsible. What you can't rejuvenate, I have to say, is your supratentorial thinking, okay? So that kind of thing, you have to figure out your blocks, get rid of them. God doesn't want you to hold on to them. They cause pain. He doesn't want you to hurt, so get rid of you. Find a way to heal. You have a responsibility, like everyone has said today, to yourself to clear out the negative from yourself. Okay, what was libido? The styrofoam husband. Okay, so libido is fully, again, below the top brain, generated by testosterone. So we have 100% success with using a testosterone supplement. I like what we do. We do a compound, so we can go at 1, 2, or 3%. You get 2 clicks, you put it on your inner thigh every night for 3 weeks, and then go to 2 weeks. So what you're doing is you have a low level of testosterone, you build it up over 3 weeks, and then you maintain it. And testosterone does, I had a patient once actually call me from Italy. She did, and just to thank me, because she had, in the middle of the night, she woke up and she said, sex sounds good. And she hadn't been that much of an initiator, and they were both very grateful. But yeah, so it works. I've had a woman in Target, Dr. Lara, and I'm going, oh my God. And she ran up to me, and then she drew her husband, who looked very sheepish. Honey, this is the doctor that saved our marriage. And I go, oh my God. And I come up and I go, I go, hi, how are you doing? I'm glad to meet you. Have a great day. Backing off. And so my boyfriend at the time asked me, what did you do for him? I probably made her really horny and made her really moist. Yeah. And that's all you need, but that's what you need to have. If I made you write down, everyone had people write down, if I had you write down what is preventing you from having the sex, the sexual relations, the making love that you desire, that you really desire. If it gets into intimacy and that communication between your husband, the sexiest thing that you can do really in the bed with him is to communicate. It's an intimacy that you only two have, that you only know, that he only knows. And I tell patients all the time, play games. You know where you can play games? I went to ChatGPT for this. This is really fun. I didn't ask that question to my partner. I asked, like, what's the next level of dating questions to ask them? You know, that sort of thing. But I did do a sex survey to see what they would say, and it came out really beautiful. It talked about your style. It talked about what emotions you have during it. It talked about when you want to do it, timing-wise. And it was just an interesting thing to do, to share with a partner, to recognize you both are different, which you already knew, but why aren't we having satisfying sex? It could be because he likes morning and I don't. It could be something very simple that you could have a solution to. So communication is really key. I would say to you that the only thing that I want you to go away with today is when it comes to making love after the age of 40, any difficulty you have, and remember that menopause, premenopause comes on horrible. My patients say, I'm not myself, I don't feel aligned, I have mood swings, I have hot flashes, I'm depressed, but then I'm not, I can't remember things, I left my keys I don't even know where I left them, you know, so there's a lot of different things being in a fog. It tells you how ubiquitous estrogen is. It's everywhere and can affect anything. So any symptom you're having in your 40s that isn't because of a known cause is probably going to be changing estrogen. So all I want you to leave here today is knowing that there are treatments, there are options. I always say women deserve options, and you really do. Okay, I'm finished. Okay, yeah. Yeah. That was fun. Thank you guys.